Hello friends, I am Dr. Vandita Hede, dermatologist practicing since 15 years. My clinic is located at Thane, the beautiful suburb of Mumbai. Friends, today let's discuss briefly about a commonly encountered problem, that is hyperpigmentation or darkening of the body folds, especially the neck, armpits and inner thighs. So what are the causes? Well, one of the most common cause that we encounter is called as acanthosis nigricans. What is acanthosis nigricans? In this we see darkening as well as a kind of velvety thickening that occurs in the neck folds as well as the underarms, inner thighs, sometimes even the eyelids, the temples. This is associated with insulin resistance. As we all know, insulin is the hormone secreted by our pancreas and it helps us to absorb glucose from the blood. But when our cells are resistant to insulin, the level of insulin in the blood is in excess, and this excess insulin in turn causes the cells of the normal skin to thicken and darken in the body folds. So this condition is often seen in people with type 2 diabetes, those who are overweight or obese, PCOS, hypothyroidism, those having adrenal disorders, those taking certain medications like oral contraceptives or oral steroids for a longer period of time. Sometimes it may even be hereditary and can be passed on from a parent to the child. In a hot and humid country like ours, another common cause of hyperpigmentation in the body folds is intertrigo, which is caused due to excessive sweating and friction. Allergies due to deos and perfumes, as well as friction due to frequent shaving and waxing of the underarms, is another common cause of hyperpigmentation. Sometimes dermatological disorders like lichen planus pigmentosis, macular amyloidosis, or even the common fungal infection pityriasis versicolor can cause darkening of the neck skin. So how do we remedy this? Well, your dermatologist will examine you and ascertain the cause of the pigmentation in your case. If you are overweight, losing weight, lifestyle modification, cutting down on sugary foods will really go a long way in reducing the pigmentation caused by acanthosis nigricans. Check your sugar levels, thyroid levels, insulin levels. Females should test for PCOS. If there is a hormonal imbalance, it has to be rectified by medications. Along with that, usage of sunscreens will also help in reducing the tanning that happens on the neck. Avoid friction due to frequent waxing and shaving. If at all you're shaving, use a sharp razor, use it as a single use, and post shaving, use a light unscented moisturizer to soothe the skin. In summer season, wear loose cotton clothes. If you have an allergy, do not apply perfumes directly on the skin. Instead, antifungal powders can be used to absorb sweat and reduce friction. Laser hair removal is a good option to reduce the frequent friction that is caused due to shaving and waxing. If there is a fungal infection, that has to be treated by your dermatologist. Your doctor will also prescribe certain safe depigmenting creams like those containing glycolic acid, mandelic acid, licorice, kojic acid, tretinoin, etc. Chemical peels like glycolic, salicylic and retinol peels will definitely help in reducing the pigmentation. In resistant cases, pigmentary lasers like Q-switched Nd:YAG and pico lasers will be suggested. I hope you found this information useful. Thank you.